Welcome to the Putnam County Library Lunch and Learn. Today we are joined by Scott McKoin, and he will be talking about lung cancer awareness. Take it away, Scott.
All right, hope everybody's having a happy Monday. Came to present a little talk on lung cancer awareness for you. If you don't take away anything else from this meeting, I want you to take away the fact that early screening for early detection is your best friend with dealing with lung cancer. And I'll get to some facts here later on that explain why that's important. And we will try to advance to the next slide. I'm gonna make it go one way or another. Well, Spencer. Operator error. That one, okay. All right, this, as I said, my name's Scott McKoin. This slide's got my bona fides on it. I'm credentialed, Bachelor of Science degree, a certified nuclear medicine technologist, and a radiologic technologist in nuclear medicine. My work history, I've been here at Cookeville Regional Medical, or been at Cookeville for 25 years, and been a nuclear medicine technologist for 35 years. The 24 years at Cookeville, I was a supervisor of nuclear medicine, and we started a PET CT program, also called molecular imaging. I'm currently serving the hospital as radiation safety officer. I'm adjunct faculty at Chattanooga State Community College, clinical instructor for students in nuclear medicine technology, and have been an invited speaker at several things state and region wide. And let's see. Okay, I want to talk some facts about lung cancer. 234,000 Americans will be diagnosed with lung cancer in 2025. Lung cancer is the leading cause of death here in America. It claims more lives each year than colorectal cancer, pancreatic cancer, breast cancer, and prostate cancer all combined. It's the leading cause of cancer death in women. It is the leading cause of cancer death among Asian Americans, Black Americans, and Native Americans. It accounts for 25% of all cancer deaths here in the U.S. The important thing is early stage detection. Find the cancer early when it is most treatable. Only 16% of the population are diagnosed at an early stage because they don't do early screening for the lung cancer like they could. There's a lot of different types of lung cancer, non-small cell lung cancer being the most common, and then in the order of prevalence going down the list, with mesothelioma being at the end. Some of these are due to lifestyle choices, some of them are due to work that people may do. There's four stages of lung cancer, or five actually, stage 0 through stage 4. Stage 0 is called in situ. It's the tumor only. There's no lymph node involvements, and it's just the tumor is just sitting on the lining of the lung, and it has no metastasis or spread to other parts of the body. Stage 1, there's 4 subcategories in that. The tumor is deeper in the lung and larger, depending on whether it's a stage 1, 2, 3, or 4 under stage 1. For stage 2, it has 2 subcategories, 2A and 2B. It's a larger tumor and it has spread to the lymph nodes. Stage 3 has 3 subcategories. It's an even larger tumor that is spread within the lung itself that it started in, and also to the opposite lung and some lymph nodes. And the most serious is stage 4. It has 2 subcategories. And stage 4 cancer is cancer that is spread from the lung outside of other areas of your body, like the liver, brain, or bones. Risk factors for lung cancer. between the ages of 50 and 80, and there's some talk of lowering that age to 40 to 80. If you have a 20-pack a year history of smoking or greater, and a pack year history is 1 pack a day for 20 years would give you 20 pack years. If you currently smoke or have quit smoking within the past 15 years, you should consider having a lung screening. Tobacco use is the primary risk factor for lung cancer. Radon gas is another risk factor. That's a naturally occurring radioactive gas that accumulates in the lower levels of some houses depending on where you live. Exposure to asbestos, that's the leading cause of lung cancer, especially mesothelioma. Secondhand smoke, if you've been exposed to secondhand smoke to any extent, you can be at risk for lung cancer. Your age increases your risk for lung cancer. Certain chemical exposures, they found that hairdressers and barbers have a higher incidence of lung cancer than the general population. Mining due to silicosis and also the radon gas in the mines. Painters have exposure. Foundry work, if you worked in a foundry, glass, plastic, or rubber industry, those people also had occupational exposure that could cause them to have a higher risk of lung cancer. If you have a family history of lung cancer or positive family history for any other type of cancers, it can increase your chance of lung cancer. And then again, radiation exposure, that's primarily from radon gas. The medical tests you have give you radiation exposure, but it's an extremely low level of exposure for a short period of time. So that doesn't greatly contribute to the risk for lung cancer. Treatments for lung cancer. There are multiple treatment options if you're diagnosed with lung cancer. Surgery, they go in and remove the tumor. Procedure is called a thoracotomy, or they can do a minimally invasive procedure where it's not as big an incision. Radiation, they can give you radiation treatments, which are high energy x-rays or particle beams or implants. They may implant these small radioactive seeds in the tumor to kill it, or do this external beam radiation where they use x-rays to go in, or photon beams to kill the tumor. There's multiple types of chemotherapy that they can do. Immunotherapy, there's vaccines being developed. There's molecular tests and biomarkers. Then they have target therapy. Those are a wide range of specific drugs that aren't chemo or immunotherapy. And then last being ablation therapy, they use radio frequency waves or cryoablation, which is freezing. They can go in and freeze the tumor to try to destroy it, or use radio waves in an attempt to destroy it. And of these 6 things, sometimes you may be treated solely with one, or it may be a combination of 2 or more of these 6 items. Survival rates for lung cancer. We started out back in the 40s with chemotherapy, and then you can see as we have progressed up to the 2000s, we have more arsenal of things to throw at the cancer to try to kill it. As I said earlier, non-small cell lung cancer is the most prevalent type of lung cancer, and I've got a graph here showing the 5-year survival rate. If it's caught early in stage 1, it's 92% survivable down to 68% survivable for 5 years. If you wait, don't get screened or tested early, going down to stage 2, 3, or 4, you can see your odds drop off tremendously. So that's why I want to encourage everybody to get a lung screen done very early. The 5-year survival rate for lung cancer, localized, is around 60%. Regional is 34%. If it's distant and spread outside the lungs to other parts of your body, drops down to 8%. But it always starts in the lungs, so that's why you want to get screened early and catch it before it spreads. Small tumors that haven't spread, A 1 centimeter tumor, you'll have a 90% survival rate in 5 years. A 2 centimeter tumor, you'll have an 85% chance of survival in 5 years, and an 80% chance on a 3 centimeter size tumor. And to give you an idea, talking centimeters, if you're familiar with the little brass BBs that go in a BB gun, that's a 5 centimeter tumor, or would be the size of a 5 centimeter tumor. So you need to get it checked early by being screened. If you combine all these stages of tumor, you have a 5-year survival rate of 22.9%. So early diagnosis, again, early screening, that's the key to long-term survival. Unfortunately, only 26% of the cases of lung cancer diagnosed are diagnosed early. Just 26% are caught early because people put off going in and being screened that are eligible to be screened. The combined 5-year survival rate for early diagnosis is 63%. That's over all the different types of lung cancer. And things that affect your 5-year survival rate are the type of lung cancer you have, your general health when you are diagnosed and how healthy you stay, your fitness, whether you're active or not, and whether you have any genetic mutations they find during testing. Talk about some signs and symptoms of lung cancer. That very often it has no symptoms until it is spread. That's why routine screening is important to do if you fall in that age category of 50 or greater, or if you're a previous smoker. So if you want to catch it early, get screened. You have local disease that's going to show up as coughing. That's most common in about 50% of the cases. Blood in your sputum. When you cough up a little mucus, it may have some blood in it. Shortness of breath, wheezing, chest pain, or unexplained fatigue, and pneumonia. A lot of times people have pneumonia, they go have a chest x-ray, that's when they find the tumor. So if you have any of those symptoms, you may want to consider being screened. Advanced disease, some of the symptoms for that are hoarseness, difficulty or pain when swallowing. You can have pleural effusion, which is fluid in your lung, in the lining of the lung, or pericardial effusion. That's a buildup of fluid around the sac that the heart's in. Then you can have distant metastasis, which are when the cancer spread. That'll give you things like bone pain if it's spread to the bones, jaundice if it is spread to the liver, weight loss. Those are all symptoms of spread of cancer. Diagnosing lung cancer. How do we diagnose lung cancer? It's diagnosed through a combination of imaging tests, lab tests, and biopsy. The final, we do all these testing, but the final answer is when a physician goes in and does a biopsy and actually gets some tissue, and they send it to a pathologist in a pathology lab, and he looks at those cells to see whether it's actually cancer or not. Chest x-ray is often the first test to show spots on the lung. They'll show tumors or other changes in your lung, and often you're in there for another reason, having a chest x-ray, and the spot that is lung cancer is an incidental finding. The next best thing is a CT CAT scan. It uses x-rays to produce a detailed image of the lung, and it is the best screening tool available. And the hospital here at Cookeville offers a CT lung screening, and it is a $99 test, I believe. So get your doctor to write you an order for it if you're concerned, and go have the test anytime. It is a very low dose screening, and that is the most important tool. You're getting a very small amount of radiation for a lot of benefit to find out and catch cancer if you may have it early. There's an MRI scan, magnetic resonance imaging, and it uses magnetic waves to create a very detailed image of the lung tissue. Spencer, do you know what MRI stands for?
Mm-hmm.
Money Removal Intensifier. It's an expensive test, but it's a very good test. It's not a first line, your chest x-ray and your CAT scan and screening CT low dose are your frontline things. Then you progress into MRI, or you may go into a machine that we've started molecular imaging at the hospital. It's called a PET scan, positron emission tomography. It's a second line scan, and it gives a very detailed image that shows if those spots they found on your chest x-ray or your CT are metabolically active. It shows if they're normal tissue or if they're cancer cells that are growing rapidly and dividing rapidly. And that's done with the radioactive sugar water that we give patients, and wait about an hour, put them under the camera and make a 10-minute scan and see if they're have it. The PET scan is, like I say, is advanced imaging, and it produces imaging of the entire body. We start here at the head and go down to mid-thigh, so we look at the entire trunk of the body. We get a lot of detailed information on whether you do have cancer and whether it is spread or not, all in one test. Other things to use in diagnosing lung cancer, the physician will order lab tests. As I said, they will do a biopsy. They will go in and take some samples of tissue from your lung or your lymph nodes, either by going down with a tube down your throat and doing what's called a bronchoscopy and washing and getting some cells loose that way, or use a needle. They will stick a long needle in and draw some cells out. They can do endobronchial ultrasound. That's where they take an ultrasound probe and look at your windpipe and your main bronchus in your lungs, the big tubes of the lung, to see if you have anything abnormal there. The thoracoscopy, they make a small cut in your chest wall and can go in and look and see, and at the same time obtain tissue if they see something concerning. A thoracotomy, that's a larger cut, and it's normally done between ribs, and they go in and extract some tissue for the pathologist. And then the last is the needle biopsy. They insert a small needle they numb your skin, insert a small needle in, and try to draw out some cells from the suspected lesion. Screening for lung cancer. As I said, screening is the most important thing, early screening. It takes about 10 minutes to have a low-dose CT scan, so it's not a long procedure. You go in, register, they do the test, takes 10 minutes, you go home, you get the results in a day or two. Medicare and most private insurers will pay for a CT lung screening. The main criteria for them to pay are you'd be somewhere between 50 and 80 years of age, you have that 20-pack year history or more of smoking, or if you're a current smoker or have quit within the last 15 years. Unfortunately, fewer than 2% of the people who are eligible to receive a lung screening receive one. So 98% of the people that could do it are not having it done. So I encourage everybody, if you are between the ages of 50 and 80, have ever smoked, had a 20-pack year history, if you're a current smoker or quit within the last 15 years, please go have a CT lung screening. Insurance will cover it if you meet those criteria. And it is important to follow up and be screened every year after that if you were in that 50 to 80 year range and have those other risk factors. The Cookville Regional Medical Center has multiple tools available for diagnostic staging and treatment. We have x-ray, that's your diagnostic chest x-ray, and that's often the first step. We have the low-dose CT lung screening, and that is the great first-line screening exam. We have MRI scanning as a secondary exam. We have the PET-CT scan as the secondary exam. The hospital has excellent radiologists to interpret your scans. We have excellent surgeons if you need surgery. We also have excellent pathologists to look at those cells or tissues that are obtained and to help make a diagnosis. We have an excellent cancer center staff for both radiation treatments or chemotherapy treatments. Back in July, we affiliated with Vanderbilt Medical Center, and their physicians staff our cancer center now, and they are world-renowned for their cancer treatments. We have a dedicated nurse navigator for our patients. She's dedicated to you as the patient to walk you through everything, explain any of these medical terms the doctors are using, and coordinate your care between the several doctors you may be seeing. She's hired and works there, but she's strictly for you, the patient. We have highly trained, licensed, and experienced imaging technologists at Cookeville Regional Medical Center. They're a great group of guys and girls. I've worked with them for years, and they are really good people, and they all take their job seriously and will do what's best for the patient. Our imaging department is certified by the American College of Radiology that shows we meet the highest standards of imaging. I want to show a few pictures. This is an x-ray. Get the pointer here. This is a normal lung over here. Oh. This is it. I'll get it right here in a minute. Bear with me. Okay. Here we go. This is normal lung over here on the right side, and here on the left, there's a tumor. You can see that kind of opaque round spot up in the top. That's what the radiologist would see on an x-ray. That's a very large one, but that's what an x-ray would look like of the lung showing cancer. This is a CT scan. I was talking about a lung screening. Have a red circle drawn around the tumor that they found on the CT scan. That's why and a normal looking slice of the lung on the right. That's why it's so important to get this CT screening. This is an MRI scan of the lung. We have a CT chest on one side, on the chest window, arrow pointing to the tumor, and then we have on the other side what the MRI looks like, pointing to the tumor. Nuclear medicine imaging. Unfortunately, straight nuclear medicine doesn't get to see people until their lung cancer is very much advanced. The picture here on the left is a normal bone scan. The one on the right shows a bone scan where the cancer has progressed and gone into the patient's bones. We give them a special medicine that the bones take up, and if there's cancer in the bones, it takes up more of the medicine and shows up as those unusual dark spots. And here's my favorite. This is the thing, the newest, latest, and greatest. It's PET imaging, or positron emission tomography. It combines the best of both worlds, PET and CT. You can see an image of the CT with an arrow pointing is this cancer, and then beside it is an image of the PET scan, and you can see there's a little bright orange spot. That is the tumor. We give a patient radioactive sugar water. It goes to healthy tissue just a little, but it goes to cancer a whole lot and stays in the tumor for a little while, and that's what allows us to make pictures. The activity goes into this cancer and stays, and it lights up, and then down at the bottom you can see just a different color and a different view. Shows a bright spot of a lung tumor in orange. And it's really a great tool. A CT, an x-ray, an MRI shows a spot. It doesn't show if that spot's metabolically active or not. Tumors are more metabolically active than healthy tissue, so they take up this radioactive sugar water that we give the patient. There's no side effects to the medicine. You won't even know it's in you. We have to start a little IV, give you the medicine, have you rest quietly for 1 hour. Then we put you on a camera and take a picture from your head down to the middle of your thigh. It takes about 10 minutes to do, and it'll let us know if that spot is actually metabolically active or not. The Cookeville Regional Medical Center has a couple of websites. I list the crmchealth.org/services/cancer for you. And it is a collaborative cancer center close from home. You don't have to travel an hour or 2 hours away to get excellent treatment. If you're diagnosed with cancer, you can have that done here at the hospital. All right, last slide. I want to thank everybody for attending, and I hope no one has any questions.
Thank you, Scott.
You are welcome, Spencer.